On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger along. Norfolk, 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 you won't be a stranger along.
Okay, we're back in here. We now need a mover and a seconder to adjourn closed session at 2:02 p.m. and reconvene in open session. Mover, Black or Black and Wells? All in favor? That is carried. Okay, we're going to now go into a meeting of the Board of Health. Mayor Luke. Okay. All right, where's my Board of Health?
I like that. We have a slight change to the agenda. It's just right here. Did you want me to read it?
Well, I'll let you just speak on it because I'm not going to take the time to. Too many papers, way too many papers. Welcome to the Board of Health meeting for this December the 5th, 2017. I know I don't have to repeat it, but our meetings with the Board of Health are also web streamed and televised. I know my cell phone is silenced, so I think I'm ready to go. We got a volunteer for the camera today? Mr. Jackson is again volunteering to do the broadcast for us today. So, Mr. Jackson, thank you very much for your help. I'll turn it over to our to Stephanie, our deputy clerk, to go through the oath of office. Oh, you're going to do that first, okay. Yes, okay. Yellow sheet, changes to the agenda this afternoon. I'll just let Stephanie, I haven't seen this till now, just she can go over it for us.
Thank you. Through the chair, essentially the changes to the agenda are taking the memos that were located within the item under staff reports and moving those specific memos to item 6 under communication.
So on the purple sheet, some of the staff reports have been moved to communications. Okay. We're going to deal with them one way or another. Is there any disclosure of pecuniary interest to declare? Board members? No. Hearing none then. I'll go to item 2, annual oaths of office. Stephanie, please.
Thank you, Mr. Chair. I now ask all of the board members to rise and repeat after me. Okay. I
Charlie Link.
do solemnly swear
Do solemnly swear
that I will be loyal
that I will be loyal
to Her Majesty the Queen and to Canada,
to Her Majesty the Queen and to Canada,
and that I will uphold the Constitution of Canada,
and that I will uphold the Constitution of Canada,
and that I will, to the best of my ability,
and that I will, to the best of my ability,
discharge my duties as a member of the Haldeman-Norfolk Board of Health,
discharge my duties as a member of the Haldeman-Norfolk Board of Health,
faithfully, impartially, and according to the Health Promotion and Protection Act,
faithfully, impartially, and according to the Health Promotion and Protection Act,
the Municipal Conflict of Interest Act,
Municipal Conflict of Interest Act,
and any other act, regulation, rule, or bylaw.
and any other act, regulation, rule, or bylaw.
Thank you. And if you could sign that for us, and that will be sworn before us in Norfolk County on the 5th day of December 2017. I will collect those later.
Thank you, Stephanie. Let's go to page 3, please, members. This is the minutes of our Board of Health meeting, which we held here on Tuesday, October the 20th, 2017. I would ask if there are any corrections to be made, anything to bring to our attention. I have read through them. I see nothing in there that's out of line. If hearing nothing, I will declare them adopted as they are printed on page 3 and thereafter. We will now go to item 4, which is staff reports. Our acting medical officer of health, Dr. Locke, is here. He will give us his update. You'll see the outline on page 9 of your agenda. Dr. Locke, good to see you.
Thank you, Mr. Chair, members of the board. The first thing that I'd like to bring to your attention is that we had a case of diphtheria in Edmonton a few weeks ago. This is something that we see sporadically in Canada, across Canada, and this is just another example, really, of failure of immunization, either getting immunization or that the immunization has waned over that period. We think of these diseases, diphtheria particularly, as a childhood disease and a historical one that doesn't occur anymore. But this is just an example that these are still around, and that if the vaccine rates fall off, we are likely, as I've said in other board meetings, to see a rise in these childhood illnesses. The Chief Medical Officer of Health issued an update on the Zika virus, and I've included it in this report because this is a time of the year, of course, when everyone is heading south and going for holidays, and we have had laboratory confirmed cases in Ontario, as I've noted there, and basically most of these were, in fact all of them were travel related, none were contracted within the country. Transmission, of course, is by mosquitoes, particularly the Aedes aegypti species and Albopictus species. And you may remember that I said that both of these species were trapped this year in the Windsor area. So we know the vectors are there. They were not carrying the viruses, the mosquitoes, but the vectors are slowly moving north, it would seem. Secondly, influenza. It's a very topical time, and I believe the clerk assistant here has just distributed an advisory that we're putting out today, a news advisory. And I've been asked some questions about this already with regards to the type of vaccines and how effective they are this year. Unfortunately, these viruses tend to mutate slightly as they make their way westerly from Australia, and this year is no exception. We're seeing a drift in the nuclear material in this virus, and basically the species that have been grown in Europe are, if they arrive here, they have a limited effectiveness with the vaccine. So it may be, if this arises here, that the vaccine may not be necessarily a good match this year. Also, they've experienced quite a severe season in Australia, and if we experience that season, we can expect to see a lot more morbidity associated with this particular virus if it comes through here. The predominant strain in Australia was a strain A, H3N2, and this particular sub-variety of flu is the one that causes most of the problems with regards to infections and complications to influenza, particularly things like pneumonia, and often, as it did in Australia this year, results in more hospitalizations because of complications of pneumonia and respiratory problems there. To date now, as I say, I've just given you the release there. We have had 3 cases. Our first cases have been reported. And these cases, remember, they represent laboratory-confirmed cases. So for every laboratory-confirmed case, there are probably many others out there that we don't know anything about and have not been tested. The 3 cases that we had here, one was influenza A, 2 are influenza B, and the 2 in the B are in an infant range, and this is fairly usual for infants. They usually go down with the B variety of influenza, and it can be very serious in the young people. As far as the vaccines are concerned this year, there was some discussion about a double strength or an increased strength vaccine that was being produced by Sanofi Pasteur. You may have read about this from the United States, and they have recommended that people over age 65 get this stronger vaccine. The vaccine itself contains 4 times the antigen that is contained in the vaccine that we're currently delivering in Ontario here. And also the Ministry of Health and Long-Term Care have also suggested that they will follow suit next year and fund this particular vaccine for over 65s. Now, the fact there can be some confusion about this because the vaccine, although it's stronger and more effective in older age groups, which of course are more susceptible to the disease, it does not increase the infectivity of it. So it's not going to decrease you getting the disease What it does do, if you do get it, you end up with a milder variety of the disease and less complications of the disease, such as pneumonia, as I previously mentioned. So it does not increase or decrease your chances of getting the disease, but it does decrease your chances of getting any of the serious side effects from it. I've included on the report there the map of the activity that's occurring in the top right-hand side. These are you can see that the rise is going on now because we're entering our season, which normally goes between November, December, and March or April of the year. And we see usually a peak which is followed by a secondary peak about 6 weeks after the original peak goes through. And the reason for that is that the susceptible people have decreased because a lot of them have already come into contact with it, but we do usually see that secondary blip coming through on the statistics with a secondary wave coming through. And I think that's about all I have for this meeting, Mr. Chair. And anyone has any questions, I'll try to address them.
Questions, the information we just received? Mr. Oliver, please.
Thank you, Mr. Chairman. Dr. Locke, just on your last point about this extra strength vaccine potentially being available, is it being offered to people here in Ontario already this year, or are you suggesting it would only be coming in and available in the 2018-2019 flu season?
I'm led to believe that it is going to be available, but it is not going to be funded.
Not funded.
So if people want it, Sanofi Pasteur have basically said it's going to be available, but it's not going to be funded probably, well, until the ministry decides that it's going on publicly funded vaccines, and that wouldn't be until next year.
All right, thank you.
Thank you. Any further questions? It's been moved by Councillor Wells, seconded by Councillor Brunton, that the health update provided by Dr. Locke be received as information. Any discussion? Those in favor? Received as information. Thank you. Thank you, Dr. Locke. I'm now going to page 81 in your agenda. This is HSS Report 17-36, Part-Time Tobacco Enforcement Officer position. Is that you, Michelle? This is Michelle Line, if you don't know her. She is here. Welcome, and with Susan. And I'll turn it over to you to present the report, ladies. Thank you.
Okay, great. Thank you, Mr. Chair, and to the members of the board. So the purpose of this report is to formalize the .5 Tobacco Enforcement Officer position as a permanent position. So our rationale for requesting this includes a decrease in efforts for annual recruitment, a decrease in the amount of training that we're investing, as well as it will create stability in the position as we move forward and implement all of the Smoke-Free Ontario modernization recommendations, as well as the upcoming cannabis legislation in 2018. And of important note, formalizing this position as permanent will not have any net levy impact for both counties. And I'm happy to answer any questions.
Thank you. Question time, Mr. Wells.
Thank you very much, Mr. Mayor. Mr. Mayor, could I have an explanation as to how this will not cost us any more money or impact the ratepayers, please?
Through Mr. Chair to the Councillor Wells. So we are provided with capped funding through the Ministry of Health and Long-Term Care, specifically in the envelope for tobacco enforcement.
And we have sufficient funds to cover.
There is sufficient funds within that envelope that cover it.
Thank you, Mr. Mayor.
Thank you. Mr. Oliver.
Thank you, Mr. Chairman, and thanks for your report, Michelle. I'm not sure if I saw the actual amount of funding that goes to this position. And there's a question here, believe me, and that is, I see another one of the reports we're being asked to consider today is a user fee charge beginning to be charged for the quit clinics. And my question to you is, would we, if we chose to do so, be able to take the funding that is presently being used for this part-time temporary position and move it over in order to not have to begin to charge people for the use cessation products that we have been providing at no charge to date? Are we allowed to move that? It's still within the tobacco program, but it would be, instead of going towards a position, it would go towards continue to subsidize the cost of those products.
Thank you, through the chair. The answer is no. When the ministry provides us with funds within the envelopes, they are very specific. So the funding that we receive for our tobacco enforcement program comes along with protocols and requirements. Those are listed within the appendices of this report, and so the funds do need to go there. Yes, we are recommending we are going to start charging a user fee for our NRT, but we would not be able to allocate any funds out of our enforcement over to that.
Further questions? I'm looking at the recommendation on page 81. Is there anybody who wish to? Councillor Wells? I have a seconder. Sonnenberg? Board Member Wells has moved. Board Member Sonnenberg has seconded. That's staff report 1736. Part-time tobacco enforcement officer position be received as information, and that the Board of Health approve the hire of one permanent 0.5 FTE tobacco enforcement officer effective December the 1st, 2017, utilizing provincial smoke-free Ontario CAP funds from the Ministry of Health Long-Term Care. Discussion on the motion. Mr. Columbus.
Yes, Mr. Chairman, to presenter, if the province were to cut the monies coming to the health unit, would we continue with this position?
Yeah, so through the chair to the member, if any funding was cut to any of those specific envelopes, then we would potentially be looking at layoffs within those positions, yes.
Okay, thank you very much.
Thank you. Further? I hear no further discussion. I'll call the question. Those in favor? Those opposed? That is carried. Thank you. Let's go to page 163, please. This is HSS 17-35. This relates to the operational audit recommendations, number 1.11, Board of Health self-evaluations. Susan, I'll turn it over to you, please.
Thank you, Mr. Chair. Through you to the Board of Health, the purpose of this report is to formally request that Board of Health members complete the self-evaluation that was distributed to you this afternoon on some mauve paper and return it to the County Clerk by December the 15th, 2017. I do want to note that the responses to this are confidential and they will only be shared in an aggregate format. Results from previous audit or previous self-assessments have been included in the package for your reference, and do want to identify that the purpose for this is to help us to assess the governance practices of our Board of Health and to use the self-evaluation to inform recommendations to continually improve performance. You'll see in the self-assessment questionnaire that there's questions related to knowledge and information needs that you might have, as well as meeting decision-making processes, responses to important issues, reporting systems in place, compliance with regulatory processes, strategic outcomes, as well as some open-ended questions to help guide our plans going forward. We will be presenting results back to you early in 2018. And with that, I'd be happy to answer any questions.
So we just fill out the mauve by a week Friday,
Yep,
put it in the envelope, seal it, give it to our clerk.
back to the clerk.
No name needed?
No name needed.
How are you going to know if Councillor Sonnenberg doesn't hand, oh, you'll know if he's the only one. You'll have the other 8. Okay, questions? Anything on the report and the evaluation? I'm looking for a mover and seconder for the recommendation. Member Columbus has moved. Member Oliver has seconded. Staff report 1735, operational audit recommendation 1.11, Board of Health self-evaluations be received as information. And that the Board of Health for the Haldeman Norfolk Health Unit endorse the self-evaluation tool, and further, that the Board of Health members complete the self-evaluation, return to the clerk by December 15, 2017. Discussion on that motion. Those in favor? That is carried. Everyone is anxious to get at the survey. Okay, thank you. We'll jump to page 177. This is HSS Report 1737. This is funding to support the recruitment and retention in primary care, and there's a budget amendment involved, and Susan, I'll give it to you as well to
Okay,
deliver.
thank you. Thank you, Mr. Chair. Through you to the board. The purpose of this report is to request that the Board of Health accept a $12,000 increase in base funding that's being offered by the Ministry of Health and Long-Term Care Primary Care Branch. The addition of this base funding will allow the health unit to realign an existing vacancy and to increase our nurse practitioner coverage in the sexual health clinic. That will allow us to increase our current nurse practitioner to a 1.0 full-time equivalent by repurposing a current vacancy that's a 0.5 vacancy. This will take effect immediately upon approval from the Board of Health and will allow us to meet the new standards that are going to be implemented starting in January. With that context, I'd be happy to answer any questions.
I'll just get them over secondary here. Thank you very much. Questions? Mr. Oliver?
Mr. Chairman, thank you, Susan. I fully support this, but I'm looking at the top of page 2 on the report where you identify to us that the part-time nurse practitioner is within the sexual health team, and this funding will allow us to make it a full-time position. Mm-hmm. Will it continue to just operate within the sexual health program, or is the nurse practitioner professional able to get involved in other aspects of community health, or will it be specific to the sexual health program only?
Yeah. So thank you, and through the chair to the board of health. The current assignment of the nurse practitioner is within the sexual health team. There would be no reason why they couldn't be involved in other things, although what we do know is that we do have additional need within that team that isn't being met right now, and so it will be helpful in our first assignment will be to continue within the sexual health team. Okay.
We are not constrained, if you like, as to what he or she could be involved in should the need arise.
It is a clinical position,
Yep.
but they could be involved in any other clinical aspect. Yes.
Thank you. Further? Any direction from board members on the recommendation? Mr. Oliver? Thank you. Wells is seconded. Oliver and Wells have moved and seconded that staff report 1737, funding to support recruitment and retention in primary care, be received as information as the Board of Health for the Haldeman Norfolk Health Unit support acceptance of the additional $12,000 in base funding currently offered by the Ministry of Health and Long-Term Care. Any further discussion on the motion? If not, those in favor? That's carried. Thank you. And the other staff report is on page 185, please. This is 17-38 report, software update to enable public disclosure. Kelsey, let's see. I think you're going to give the report.
I am.
Thanks, Kelsey.
Through the chair to the board, thank you for having me here today. The purpose of this report is to request support to spend monies to upgrade software to enable public disclosure. As the Board of Health was made aware, effective January 1st of 2018, the Ontario Public Health Standards will implement new requirements, one of which will be public disclosure. The majority of the items requiring disclosure are inspection-based, are restaurants, pools and spas, tattoo parlors, hair salons, water haulers, etc., as well as any complaints associated with these facilities. Public health inspectors document all this data into a software system known as Hedgehog, which holds the monopoly on inspection-based software systems for the majority of health units across Ontario. We are currently using the classic version of Hedgehog that came out before disclosure was even at the forefront of public health deliverables. Therefore, it is not only outdated, but it does not provide the module necessary to migrate our data from the software system inspectors use on a daily basis to an external web-based disclosure resource as now will be required. By upgrading to the most current version of Hedgehog, Hedgehog 5, it will create efficiencies in the work conducted daily by your public health inspectors. It will give us more modernized options to be able to complete this work, and most importantly, it will provide the module necessary to migrate our data to a web-based disclosure platform. The cost of this software upgrade will be $16,800 and includes a technical support team from their company, Hedgerow, to work alongside our IS department as well as our team. Therefore, there will be no additional cost for any bumps in the road we may experience while we transition to the new version of this software system. The cost of this software upgrade will be supported within our budget. However, staff will be sending in a one-time funding request to the ministry for this purchase. I will be happy to take any questions.
Mr. Wells.
Mr. Mayor, the present system, to the author of this report, the present system we have, Hedgehog, is working well,
It is. Through the
but we
chair,
need
member.
to have it upgraded.
That's correct.
And we don't envision any problems like we have had in the past with the SAMs as an example, which we don't envision any of those problems.
Yeah, through the chair to the member, no. Any glitches or software updates, we can work those out in-house, and it's been working smoothly ever since we've had it in that state, for sure.
Good news.
Thank you.
Thank you, Mr. Mayor.
Thank you. Further questions? The recommendation is on page 185 of your agenda. What's your wishes? Mr. Wells, moved. Mr. Brunton has seconded. Wells and Brunton. Staff report 1738. Software update to enable public disclosure. Be received as information that the Board of Health for the Alderman Norfolk Health Unit supports the request to spend existing budget dollars to upgrade Hedgehog software to enable public disclosure. Any discussion? Those in favor? Oops, I'm sorry, Councillor Oliver, or Mr. Oliver, my
Yeah, thanks,
apologies.
Mr. Chairman. I certainly support the recommendation, but our staff member indicated we're going to be making a request of the ministry. Does that last paragraph of the recommendation, in a sense, weaken our request? We're going to request funding from the ministry, but we're saying we've got budget dollars existing now to pay for it. I mean, I guess we have no choice but to disclose that fact, but are you in any way optimistic that we will get this funding request approved?
Through the chair to the Board of Health. The reason we would do that is, of course, this would be funded from our existing shared mandatory programs budget, which, as you know, we oftentimes aren't able to stay within the 75% provincial, 25% municipal. And so even though there is approved budget there that we can use to fund this software, it is beyond the 75% or beyond the 25% municipal.
Any other questions on the motion? Discussion? No. Those in favor? Carried. That's it for our staff reports on our Board of Health agenda. I now will go to communications. I will read the motion and go through the communications. Well, I'll go through the communications on the back, item 6 of your purple paper. There are communications from the Thunder Bay District Health Unit, and one from Kingston, Frontenac, Lennox and Addington Public Health, Algoma Public Health, Peterborough Public Health. Over on the front page, item 4, we have put staff report 1736. Staff memos, so these are all from Michelle Line, I believe, on the update on cannabis. Item G, 1735. We dealt with we've got those evaluations. And finally, item H, it's recruitment and retention in primary care budget amendment. It's been moved by Wells, seconded by Brunton, that communication items A through H inclusive be received as information. I'll open it for any questions, discussion on any of those 8 items. Mr. Oliver, please.
Mr. Chairman, if I heard you correctly, are 2 of the items in this motion the staff memo on the smoke-free outdoor spaces bylaw, or are we dealing with that elsewhere? That's within this omnibus motion? Okay, it is. Will you permit a question or a comment on that, Mr. Chair?
Absolutely.
Okay.
Yes. Yeah. I'm not trying to eliminate the question period.
No, I understand.
just read the motion. They're all up for questioning
Yep.
or discussion.
Okay, thank you, Mr. Chairman. Just to comment to staff, I do appreciate the efforts that have been made to modify the bylaw, and I presume at some point in the future, the bylaw itself will be coming back and requiring approval. My only request on that one, Mr. Chair, is that at the point at which it comes back, could staff please show us both the former wording and the modified wording where they have attempted to meet the concerns that some of us had previously. So that's very helpful to me, at least, if I can see. If I was mousing about something 6 months ago, I want to remember what it was when I see the new wording presented. So that's my first comment. My other one, and I mentioned this to Michelle before when she was giving us one of her other reports, the proposal to start implementing a user fee charge for reduction therapy products for those folks that are addicted to cigarettes is disappointing to me. I understand we're trying to do it as a cost reduction measure or as a revenue generation measure, I'm not sure which. But it is disappointing because I've thought since we've been doing that that's probably one of the most successful measures that we have under our whole smoke-free program to get people to stop smoking. If you give them financial support with the therapy, whether it's nicotine reduction or gum or whatever it might be, I gather it works, and it's a shame if we're now going to be starting to charge for those products. And I don't know if there's any other alternative. Again, I presume we'll have to deal with this under user fees at some point, but I'm disappointed to see that this is one that we're going to start, because to me, it undermines some of what we're trying to do with reducing smoking. So I don't know whether staff want to comment on that at all. I just wanted to get that off my chest, Mr. Chairman.
Sure, thank you. And through the chair to the board member. Yeah, and so certainly ideally we would love to be able to continue to provide at no cost to our community. But as we've been providing this service and it has been quite successful, our demand is exceeding our supply. And we don't currently have enough budget to keep up with the demand. And so we have been very successful in applying for the one-time funding grant the past 3 years. And we have received, that's how we've been funding our program. But we'd like to be able to make it a more equitable service for everyone, not just first come, first serve. And so we worked quite closely with finance, working on this calculator. And it does actually line up similar to our other services, such as our birth control that we offer at low cost as well. And certainly, if for those who cannot afford, there is an assessment. So if someone cannot simply afford it, it will still be provided free at cost.
Mr. Columbus.
Yes, on that same issue, the outdoor spaces bylaw. Going to page 77, in that table that's there in the middle of the page, the top left-hand corner says fine structure, okay? And then the recommendation, this act sets the fine at $250 for smoking or holding lit tobacco in an area where prohibited. And then the one below that, the recommendation is a progressive enforcement approach be taken, including education and warnings before charges are laid. Would we not give them a warning first before we actually charge a person? Because, you could have a sign there and they could be blind and not see the sign. And so I'm just wondering, I would think that we'd give a warning first and then the second time you'd lay the charge.
We are recommending the progressive enforcement where we do education and then provide warning and then go with the charge. We would do that throughout most of the circumstances.
So you would give a warning
Yes.
first? Okay, thank you.
Further questions? Motions to receive items A through H as information. Those in favor? Carried, thank you. Any other business? I have one. I've ended up with 2 surveys. I know I'm not that important. Is this one yours? Did you want to fill it out, or you want me to do it for you? I'll make sure you get it. I thought it might. Susan Taylor has 2 other items for other business. Sorry, Susan. Thank you.
Thank you, Mr. Chair. I did distribute to the Board of Health just before we started our meeting. You'll find a Board of Health primer that's on your chairs. What it's intended to do is there is a certain amount of complexity to a number of the memos and reports that we've included. So we've provided you with some quick speaking points so that if you are finding constituents with questions, and this would be regarding the Smoke-Free Ontario modernization as well as some of the cannabis work that we're doing. So we wanted to provide you with that for your ease. And then the second was I just wanted to make a quick announcement and give you an update about our baby-friendly initiative survey that was done in early November, and very pleased to say that we were commended for meeting the most of the requirements for that designation. So in particular, there was acknowledgement of our community breastfeeding supports, the breastfeeding policies and demonstrating compliance with those policies, and as well as our staff knowledge for the policies and best practices. Want to certainly acknowledge the Health Units Baby Friendly Initiative Committee, our community partners, including the Haldeman Norfolk Reach, Norfolk Roots Midwives, Haldeman Norfolk Women's Services, Norfolk General Hospital, and the Haldeman Norfolk community. And it's not written here because it was done by our Health Unit staff, so I do want to acknowledge as well the leaders of our Health Unit staff team who made this possible for us. So wanted to share that with you. We will be bringing forward a more detailed report to the Board of Health early in 2018.
Mr. Black?
I'd like to thank Susan for providing these notes, but I don't really need them because it's a simple answer for me. If anybody asks me about smoking, don't do it. It's deadly and it costs millions of dollars.
It'd be nice if it was that easy. It's not. Anything else under other business? I will need a seconder to go to the confirming bylaw. It has been moved by Mr. Wells, seconded by Mr. Columbus, that bylaw 2017-12 BH, being a bylaw to confirm the proceedings of the Board of Health for the Haldeman Norfolk Health Unit at the Board of Health meeting held on the 5th day of December 2017, be passed, signed by the clerk and mayor, fixed with the corporate seal. Discussion, those in favor? Thank you very much, staff, and thank you, board members, for your attendance today. And I also want to thank everyone that has come in early for our 1 o'clock start this afternoon. Chairman Sonnenberg, I'm going to turn things back to you, including your survey.
Okay, if I could have your attention, please, we're going to get back on the agenda here. We've had a discussion up here, and before the deputation at 3 o'clock, we will just take a 10-minute break until then. So we're in a short break. Thank you.
On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just a place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario, south coast, you know, and it's surely not remote. If you pass through or spend a day or decide to call it home, you'll see why we love it here and are proud to call it our own. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk Take in the small town atmosphere, be amazed at all that we grow. Like our kids that go and see the world and can't wait to return home. Drop a line in a placid lake or stroll along the shore. Take a tour on a peaceful country road and bound to be back for more. Of Norfolk, Norfolk, my Southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. With hard work, we built a dream that only willing hands could do. It's on display at our fall fairs and at all the festivals too. Erie beaches, Carolinian forests, where the flower and dogwoods bloom. Patchwork fields and rolling hills, it's just the place for you. Norfolk, Norfolk, a southern county home. Norfolk, Norfolk, we know you can't go wrong with the friendly folk of Norfolk. You won't be a stranger long. Norfolk, 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 you won't be a stranger long. On a strip of sandy soil lies a county called Norfolk. It's Ontario's south coast, you know, and it sure